You're a first time parent who's debating if you should give your 1 day old baby their first vaccine. You've been told personal stories of side effects that sound scary, and you're nervous about how your child may react to their vaccine. Or maybe you simply don't have any trust in the government and think drug companies care more about their profit than your child's safety. These are all valid concerns. But let's look at facts. Robert Smerling, a faculty member at Harvard Medical School, wrote, in the US, widespread vaccination halted the ongoing spread of measles more than 20 years ago. A major public health achievement. Before an effective vaccine was developed in the 1960s, nearly every child in the US got measles. Complications like measles related pneumonia or hearing loss were common, and 400 to 500 people died each year. This proves that vaccines weren't just created randomly, they were made for a purpose, and that was to stop the spread of diseases that could eventually be fatal. Vaccines are not only effective and safe, but also essential for public health. And today, I'm going to prove that they have a history of saving lives and that the side effects are less dangerous than the disease they prevent. For example, when we compare measles outbreaks before and after vaccines, the difference is unbelievable. Yes, things like hygiene and healthcare have improved over time, but immunization programs have played a huge role in stopping the spread. You might be wondering, well, maybe measles just isn't a thing anymore. The truth is, it hasn't disappeared, and neither have a lot of other diseases. They have just been controlled because of these vaccines. According to Frieder and his colleagues in the American Journal of Immunology, 96% of the cases occurred in the patients which were unvaccinated or unknown vaccination status. You also may be thinking, what about all the stories of those who received a vaccine and experienced side effects? Well, they may have experienced side effects, but it's nothing compared to what people experienced before vaccines. Nazim Miller wrote, severe side effects range from 0.1% to less than 0.01% of vaccination cases. Evidence shows that 4 in 100,000 children may develop febrile seizure. Some might argue that, well, there's still a risk, but bottom line, the risk of a serious side effect is low and the risk of disease is higher. Would you rather risk your baby having a mild fever or risk them getting disease that could cause hospitalization or even death? And remember, because of one's experience with vaccines does not mean everyone else will have the same experience. This brings me to my next point. Vaccinations are not only for protecting yourself, but the people around you, especially those who are considered high risk. This is why community immunity matters. According to the Office of Infectious Disease and HIV/AIDS Policy, this is called community immunity, and when enough people are vaccinated, germs can't spread as easily through a community. I understand that people believe it should be a personal choice to be vaccinated, but a disease will not consider your choice. Now, if I were holding my newborn baby, I wouldn't base my decisions on someone else's experience or my fear. I would base my decision on what evidence has shown and what will protect my baby's overall health. No, vaccines are not perfect, but they have saved lives and they have proven to help, and this is why I stand in favor of vaccines.